I'm Dr. Jarrod Cornehl, and one of the main focuses that I do in my practice is Botox for TMJ. I get tons of patients coming to see me every week that have so much pain. They have gone to every single person that they could think of, their chiropractors, their physical therapists, their physician, and no one can seem to find the source of their pain or can't get them out of their pain. And their solution typically is, here, use this night guard appliance. And a lot of patients don't tolerate that, or it doesn't work for them in the fact that it doesn't get rid of their pain. It protects their teeth, but it doesn't get rid of their pain.